Our parents never tell us this particular topic we're going to mention today. Today's discussion center on menopause.
I think it's something that people need to be aware of. Menopause is, it describes a stage of a woman's life when a menstrual period stops permanently. When I was growing up, I didn't see my period until I was 14 years old.
Okay.
And my period was never regular. For you to be in a state of menopause, it has to have, you would not have seen your period for about 12 months consecutively.
Hi everyone, welcome to Wisdom for Exploit with me, Bola Amore. Today I have a wonderful guest with me. Before I introduce my guest, we have an important topic today to discuss about. And please do subscribe to our channel to get updated on new videos. Thank you. Yeah, today's topic, before I introduce my guest, is going to be an important one. So if you're a lady, come closer, come and listen to this topic. It's really going to help you. Yeah. You know, sometimes in life, when we're growing up as a young girls, growing up, our parents never tell us this particular topic we're going to mention today. They always tell us, oh, don't follow boys. Don't do this, don't do that. They teach us how to clean the house. They tell us how to, respect people. They even tell you when you get married, what to do when you get married, what to do to your in-laws and all those stuff. But our parents never mentioned this thing we're going to discuss today. So that's why it's very important. You need to listen to this wonderful topic. So today I've got with me Pastor Toyin. And then she is a midwife with years of experience in midwifery, a wife and a mother of 3 grown-up children, a marriage counselor, and she's also an author and a coach. Welcome, Pastor Toyin. I'm happy to have you on this talk show. Welcome.
Yeah, welcome, man. Good afternoon, everyone on the platform. God bless you, man.
Thank you for joining me.
Thank you for this support. Thank you for the privilege of coming on this platform. I do appreciate it. And God bless you.
Oh, thank you. Thank you, Pastor. Thank you so much. Yeah, today's discussion center on menopause. So we're going to be looking at menopause. And we know this is an issue for young ladies, women some people get to menopause early now. So that's why I say, ladies, you need to get closer to come and listen to this. So today's discussion is centered on menopause. So my guest, it is uncommon for parents, we know, as I've said earlier on, to discuss menopause with their children, especially the ladies. I know they talk about sex, they talk about marriage and all those stuff. So could you please explain what menopause is and provide information on the typical age range in which it occurs?
Okay, thank you very much for this privilege once again. I want to say, like you said earlier on, that our parents, they tell us about, oh, your period, have you seen your period? When was the last time you saw it? But they never discuss anything like menopause.
Mm-hmm.
And the funniest thing is, even people around you, people, probably friends and families, and that have reached the age of menopause and have gone through it, they never tell you about what they go through. Until you actually experience it yourself.
Exactly.
Because it's something I experienced, and about 2 years ago, I started having all the symptoms, all this. I'm like, come on, Tony, what is wrong with you? What is this? And I was like, I don't like going to the hospital. I'm not hospital friendly. I'm not, I don't. And I was just thinking, what is happening? I was just praying, like, God, please, what is this? Because when I when I sleep at night, I'll be having pain in my bones, bone pain, and my head pain, and palpitation.
Really?
I'll be like, what is this? And I think I was off sick for some time. And one day when I got back to work, my colleague, we were just discussing something, and she
Mm.
was just mentioning that, oh, she was off sick for sometimes ago. But she got back. She said, but when she went to the
Mm.
GP told her that it was menopause, that
Wow.
she was having the same. So she was just telling me about the symptoms I was having, that
Wow.
she was having pain in her bones, and she went to the GP, and the GP sent her to the hospital for
Mm.
test, for bone marrow test, and all those things, and there was nothing. They couldn't find anything. But eventually, they now realized that it was menopause, that she like premenopause stage. I'm
Wow.
like, oh, okay. We start. I'm like, okay, because I was thinking, what is this?
Yes.
So it was when she said that I'm like,
Mm.
okay, is this what premenopause state is? So
Mm.
I said, but nobody ever told me. I have a sister who is now over 50. I mean, over, she never told me. My mom never told me. The people that are even older than you around you, they will never say anything.
Mm.
So it is true what you said, that you know your parent never told you about these symptoms. And
Yeah.
I think it's something that people need to be aware of,
Sure.
so that when they start having these symptoms, they will not be fearful.
Mm.
Because some people, when they start having some symptoms, they start thinking, oh my God, do I have heart problem? Oh, do I have bone cancer? Oh, do I have did I have brain hemorrhage? Do I have, because if they're having headache and it's not going away, though
Mm.
there are some symptoms that might be because of other things.
Mm.
But when you are reaching that stage, that
Mm.
age of menopause, at least if you are aware that these are the symptoms of menopause,
Mm.
you will not, you'll not be afraid. You'll be like, okay, maybe this is what is happening.
Mm-hmm.
Even though if you're having those symptoms, you can still go to your GP to go and check. But at least you have awareness of, okay, when you reach the age of menopause, these are the things that can happen.
Mm.
And that is why
Mm.
I'm really glad that we are doing this today, because there are many people out there who does not know.
Sure. Sure. Sure.
Yeah.
Yeah.
So I would say is menopause is, it describes a stage of a woman's life
Mm.
when a menstrual period stops permanently
Okay.
and she can no longer get pregnant. That's the, but with God, there's no menopause. There's no,
It's mental stop.
yeah, no, yeah, yeah. And it's not a disease.
Mm-hmm.
It's a normal part of aging for women.
Mm.
So it's not a disease. um,
Mm.
and and um we just have to take it that, okay, at a point in time in life we'll go through this stage,
Mm.
just like before you started your period. Before you start your period, they'll say, oh, have you started your period? There's a stage in a woman's life that they will start having periods. There is a stage in their life that the period will be regular, in between, it will be so regular
Mm-hmm.
for those who periods are regular. And
Mm-hmm.
there'll be a time that it will start playing up, and because the hormones that controls that aspect of our lives is just diminishing.
Mm-hmm.
So, and there'll be a time that it will stop totally.
Mm.
So you must be aware that yes, it's in stages. So if you're aware of those stages, then you
Mm.
will know that, okay, this is the stage I am right now, and these
Mm.
are the things that can be happening at this stage. So
Mm.
it's very much, it's very important to be aware of these stages. And
Mm.
with the menopause, normally, like research said, it can start from 40 years old up to 40, 55 years.
Okay.
40 to 55, but is everybody is different.
Yeah.
Everybody is different. So that is what menopause is. Is a period where women experience like um stoppage in their period, where they will not see the period anymore, where they will not be able to get pregnant anymore. Like I said, with God, with menopause, you can still get pregnant. So that is what menopause is.
Okay. Thank you so much, Pastor Tony. Yeah. But can I quickly ask this question before I move to my second question on menopause? What about ladies that in their 18s, 20s, and 20s, 25 normally have issue with period? So does
Yeah.
it mean could that be a sign of menopause, or could that be a sign of something else? Because I've seen some lady, they say, oh, I missed my period for a couple of months. I haven't seen my period. So could that be as a result of menopause? Because someone was telling me recently that there are few ladies in their 20s that have reached menopause already. So what could that be?
Well, I wouldn't say they've reached menopause, but it's possible because there's something they call premature menopause as well.
Okay.
And it's a menopause that happens before 40 years old. People clock 40. And it can even happen in their 20s. But the reason I said that, I will not say that, is because when I was growing up, I didn't see my period until I was 14 years old.
Okay.
And my period was never regular.
Mm-hmm.
Sometimes I will have the period for about 6 months. Sometimes I might not have it for 6 months.
Okay.
So, so I wouldn't say at that point that maybe I was going through premenopausal stage of my life. No, I wouldn't say that, because there are other conditions that can make you not to see your period.
Okay.
Okay. And I believe that when I eventually, because I went to the hospital, they tried to say, okay, what happened? At the end of the day, they said, oh, I had polycystic ovaries, you
Okay.
know, which can cause irregular period. And yes, that was all. That was what I had then. But with the premature menopause, is sometimes called primary ovarian insufficiency.
Okay.
When the ovary stops producing estrogen the way they should, because estrogen, controls. Yeah, it's one of the hormones that is produced through our ovaries,
Okay.
and if the ovary starts producing insufficiency
Mm.
estrogen,
Yeah.
that can cause premature menopause.
Okay.
Yeah.
Oh, okay. Okay, I got it now. Yeah, thank you very much for that. So the second question I've got with me here is, what are the three stages of menopause and how do they differ from each other? I know you briefly mentioned the premenopause and all those stuff. So what are all the three stages of menopause and why are they differ from each other?
Well, we have discussed about, when you're having your period, the regular, that's the regular thing. You believe that maybe that's what's going to happen for life.
Premenopause.
Yeah, that's not premenopause. I'm just talking about the regular one now.
Okay.
But we're going to go into premenopause. Perimenopause is when your period starts, just doing whatever it likes.
Fluctuating.
Your period starts, maybe you will see it for 1 month and in the next 3 months it will not come, and maybe the bleeding becomes erratic. Maybe you are now bleeding, your bleeding now becomes so much heavier than ever before, or maybe you're not having little, bleeding, and things just like, that things are not just the way they're supposed to be.
Okay.
It's like it's fluctuating, and that is caused by fluctuating hormone levels.
Hormone level. Okay.
Hormone levels, which can cause irregular periods and potential symptoms like hot flushes and other things will arise. So that's perimenopausal, perimenopause.
What's
And menopause is the point where a woman has not had menstrual period for about 12 consecutive months.
okay?
So that indicates the end of their reproductive years.
Okay.
Okay, with perimenopause,
Yeah.
you can still be, if you have not seen it for 11 months,
Yeah.
and all of a sudden it now happens again, then you have not reached menopause.
Okay.
You are still in that state of perimenopause.
Okay.
So for you to be in a state of menopause, it has to have, you will not have seen your period for about 12 months consecutively. So there's no breakage. Don't say, oh, I just had a spot in between. It means that you have not reached menopause. So once you have not seen for about 12 consecutive months, then you have reached menopause. And the next stage is the post-menopause.
Yeah.
And this stage begins after menopause. And that lasts forever. It lasts until we go into the grave.
The old
With
age.
yeah, with that hormone levels remaining very low,
Mm,
it's not fluctuating anymore, so
mm,
it's just low.
yeah.
So those are the three types that we have. Okay, premenopause,
Mm,
menopause, and postmenopause.
okay. Thank you very much. Thank you very much, sir. So, how can hormonal changes during menopause affect a woman's physical and emotional health?
Wow. um it's I want to say that, like, I said earlier on, that sometimes until you start having it, you're not
Mm,
even aware that this is what
mm,
is happening to you.
mm,
That is why we need to be aware. We need to know that, okay, once I've started seeing these symptoms, you know, um, it means that, okay, am I reaching menopause? You have
mm,
to look at your age. What
mm,
is my age right now? Am
mm.
I, is it that is menopause period, or is it something else?
Oh, yeah.
And what I would advise is, once you start seeing that your period is getting irregular, and you are seeing some symptoms that are not really palatable, I
Mhm.
would advise the person to go and see their GP,
Okay.
because so that you will not mistake those symptoms for something else,
Yes.
and you
True.
will not mistake those, something else for those symptoms.
True.
Because if you know that it's premenopausal symptoms, you know
Mm,
that, okay, I just need to know how to manage this period.
mm-hmm.
But if it's something else, then you might need to get, another treatment for it. And
Mm,
the symptoms that do occur,
mm,
with premenopause is, sometimes you can have sleeplessness. Some people
mm.
are not able to sleep.
Insomnia.
That is when you start insomnia. That
Mm,
is when, normally, maybe you have your good night's sleep, but
mm,
now you're looking at 1 midnight and 1 o'clock in the night, two
mm.
o'clock, 3 o'clock. You're not able to sleep.
Wow.
You're like, what is happening? Because
Mm,
it does happen. So that is one of them. And you start having hot flushes,
mm.
like nice sweat. When I was going through, I was like, what is this, for God's sake? I'll be in the room. I want to put on the fan. My husband will be like, come on, it's cold. I'll be like, okay, what do I do? And when you put on the fan, or maybe you take off your clothes, before you know it, maybe in an hour's time, you start feeling cold again, and you start feeling cold again.
Mm.
So you have to, like, it's just like going like a yo-yo. Okay, oh, feeling hot very in this minute, in the next minute you are feeling very cold. So
Mm.
it's something that's it's not really, it's not palatable.
Mhm.
It's not something, that
Something
experience is,
nice, isn't it?
yeah. And so it's, you have to know that when you start feeling hot flushes, you're just feeling hot in your high face, like you're having sweat on your face and on your chest, and you've not done anything different from what you have been doing in the past 20 minutes or 10 minutes or 5 minutes. It
Mm.
just occurs,
Mm.
that, what is happening here? Hot
Yeah.
flushes and nice sweat. You just be sweating,
Mm.
when it's not really hot. The weather is
Mm.
not hot. The
Mm.
weather is what I believe that controls the, our temperature.
Yes.
So it's not hot, but you are feeling hot. So
Mm.
know that there's something, something is coming on. Then some people have body aches.
Mm.
Body aches, just body aches just come all of a sudden. You just, like I said earlier on, I'll
Mm.
just be having pain in my bones. I'm like, what is this? You know, and it's just there. It's not as if you have done something extra job of extra work that will make your body to be aching. You
Mm.
just be aching. That is one of the symptoms. And sometimes you have headaches as well.
Mm.
Headaches that is not, and headaches can be a cause of something that, as a result of something that's why I say, anytime you have those symptoms, don't just think, oh, it's just menopause. Go and check yourself out, so that in case there's anything else, you can treat it. um
Mm. That's
and
true.
some people begin to, put on weight.
Oh, yeah.
Yes, they start putting on weight. Like myself, normally I'm a lean person. I'm not a big person. But that period, no matter what even if I don't eat, I still put on weight.
Mm,
I started adding more flesh. I'm like, what is this?
mm,
Even not eating that much, you're still having, you're still,
mm,
I was like, what is this? So when you start seeing yourself putting on weight, don't think it's abnormal. It's just
mm.
the state that you are going through.
Okay.
So it is not abnormal. It's just, but you know, we just have to know how to manage that state. You know, and some people, we have mood changes.
Mm,
Their mood changes because it's just because of the fluctuation of the hormones, the
mm,
estrogen and progesterone. When
mm,
they fluctuate, things changes in our bodies. Just like when you're pregnant, pregnant women sometimes they can be so so moody. They can be so anything can happen with
mm,
pregnancy. You can forget things. You can. So those hormones are the ones that fluctuate, and when they fluctuate at that period,
mm,
you can have mood change. You can. Today you're just like, I'm just moody. Tomorrow you can be happy. You can be, but
mm.
with all this, I believe that you can ask God to help you through that
Exactly.
period.
Okay.
Because what I always say is that, look, hormones, you don't have power over my life.
Mm,
Hormones, you cannot have power over my emotions.
mm,
I'm in charge here. So whatever is born of God overcomes the world. I'm born of God. I'm an overcomer. Overcome you. You cannot fluctuate and have any effect on my emotions.
mm, mm,
Because some people have that. Some people's emotions can make them to become depressed. you
mm,
know they start doing things that maybe shouting on their spouse, shouting on the children, making the home to be unbearable for other people in the house. No, it doesn't have to be like that. You can take charge of your hormones. But some people can, actually go to the GP and get hormonal therapy, for their hormones. But if you're a Christian, I'm saying that, look, you don't have to allow the emotions to take you over.
mm.
And then some people, they have painful sex, because of dryness of the vagina,
Mm.
which normally will be controlled by the hormones. But
Okay.
now that the hormones that misbehaving, let me say they're misbehaving, you know,
Yeah,
people who
misbehaving.
have people who have vaginal dryness,
Mm.
and because of that they have painful sex. And um and some people, the symptoms, they
Numerous.
varies they
Wow.
varies they
Okay.
varies from one person to the other.
Yeah. Mm.
So it's not, you can't say because this person is having the symptoms, then I will have the same.
Yeah.
So mine might be different from yours, but there are some that are just basics, like, because some people, when they are doing that period, they can't go to work.
Mm. Mm. Mm.
Some people, when they are doing it, they can't do the things they used to do before.
Wow.
you know So that is why in the place of work, they need to put it into account that, look, this person might be going through menopausal period, and they have to put that into consideration of how they treat them.
Mm.
And yeah, so those are the symptoms that can actually say right now, but they can be much more than that because everybody experiences it this different ways.
Mm.
Yeah.
Wow. Thank you. That's quite a lot, isn't it? That's quite a lot of symptoms.
Yes. Yes.
So menopause is quite broad, isn't it? So
It is.
I remember you mentioned okay, thank you for that info. I remember you mentioned your part of your symptoms was bone pain and all that. And my next question says, how does menopause impact bone health, and what step can women take to protect their bones during this time? So people that have the same, let's say similar symptoms with yours, so how can they take protect their bones during this menopause period?
Um, what I would say, like I said earlier on, if you start having pains in your bone,
Mm-hmm.
um the best thing to do is to go to your GP, I mean to go to your doctor,
Yeah.
to find out why are you having pain in your bone,
In your bone.
because it might be to a different cause. It might be something else that is happening to you.
Mm-hmm.
Some people, when they have bone marrow disease, when they have different kind of other disease, they can have pain in their bones.
Mm.
um but with menopause, because of the hormones, you can actually have pains in your bones.
Mm. Mm.
And like me, what I did, well, I wouldn't say I went to my GP for this. I because I heard it from my colleague that said, okay, oh, I went to the GP, I did bone marrow test, which means they have to put needle in my bone and take sample of the. I said, I'm not doing that. I'm not going to do that.
Wow.
So
Oh, Maro.
so I realized that okay, it's possible that it's the menopause. But
Mm.
please, me, I, like I said earlier on, I don't like hospital. I don't like tests. I don't like all those things. I know what I do. I pray,
Mm.
and God answer my prayers.
That's good.
And I trust in God absolutely, that
Mm.
whatever is happening with me, it can handle it. So don't just, if you're not a Christian, just ignore that aspect. But I can tell you, God can handle anything.
Yeah.
So, but the health of our bone, is like we need to watch our diets. The
Mm.
diet that we eat. Make sure you eat food, that is rich in calcium. You
Okay.
know, maybe your egg, your maybe yogurt. A pot of yogurt is not. Will not do you bad.
Mm.
um you know all the food that that is rich in calcium, make sure you eat in them. And if you are, I'm sure they're doing tests on almost every woman now, especially black women,
Mm-hmm.
if because we are normally low in
Oh, okay.
vitamin D, and that can, if you have low vitamin D, that can make you to have pain in your bones as well.
Mm.
So if you can eat food rich in vitamin D as well, and make sure you get enough sun. If you're in this part of the world, Western world, you might not get sun,
Mm.
for a very long time, but eventually in summer you will get some sun. But
Okay.
then you can take vitamin D
Mm.
supplements.
Okay.
And the doctor, they recommend that for every black woman. And like, take vitamin D. Even I believe everyone in this United Kingdom, they recommend that you take vitamin D.
Okay.
Okay, supplements, so that your bone can be nurtured. It can be supplemented. Um, so yeah, and I believe you can eat like oily fish. Like mackerel.
Uh,
Yes, and those fish that you believe that they have natural oil, not you
mm.
know, yeah. So with your food, with your nutrients that you take
Mm.
in, you can actually protect your bone you know, from injury, and
Mm.
from being weakened, and from being now leading to fractures, and all those things. Yeah,
Mm.
that's the way you can actually protect your bone.
Wow. Thank you very much. Thank you. That's quite impactful. Yeah, I'm jotting down. I don't know if I'm monopause or not. Pause, let me stop. So the next question is what roles does estrogen, is it? Yeah. Estrogen play during menopause. Estrogen, isn't it? Yeah,
Yeah.
during menopause.
Mm.
So
Like,
what role does estrogen play during menopause, and what happens when estrogen levels decrease? So what happens when estrogen level decrease?
okay, what happened to me? Like I told you earlier on that these hormones like estrogen and
Mm,
progesterone, they are the hormones of
mm,
the ovaries.
okay.
Yes, and as you age, the ovaries now start. Producing very reduced level of estrogen. and
Mm-hmm.
progesterone, because it's getting tired, because so it's not able to produce as much as hormones that normally, as women, those are the hormones that makes you to give you breasts, I mean, like make you to get pregnant, make you to shed blood when you are not pregnant, makes you
Mm-hmm.
to, it actually nurtures our body as well as women. It's sustains our emotions. Sometimes when you laugh, when you cry, those hormones are the things that makes you. That's why when some people, when they are now at the premenopausal stage, and
Mm-hmm.
they're not able to get enough estrogen to sustain that emotions, that's when they get depressed.
Oh,
They start having emotional imbalance.
okay.
you know so those hormones, they have their job, they have what they do with our body. So sometimes it's so like now you have your breast intact, they're plumpy, you have your body, you blossoming.
Mm,
So when the estrogen decreases, it can start affecting your skin, affecting
mm,
your bone. At that middle age, when you're about 20 to like 40, you're always everywhere. You want to jump everywhere. You are so active, and
yeah.
so those hormones helps our body. It helps us to give us energy, you
Mm,
know. And when you now reach perimenopausal, that is
mm,
when you feel tired. You feel so fatigued. There's fatigue setting. you know Tiredness is one of the symptoms of perimenopausal. I didn't mention that.
yeah.
You just feel so tired. You don't
Mm,
want to do anything.
mm,
So those are the hormones that helps us to be active, to be women.
mm,
But now that they're now decreasing, that the ovary is not producing as much as they should do, that is
mm,
when we lose our strength a bit. Tiredness sets in, um, emotional instability sets in.
mm,
Your bone, when you can run, you can do all these things before. Now you are now. I mean, you now have to minimize all the things that you have been doing before.
mm.
So estrogen actually is very active hormones in our body.
Good.
But when the ovary is not producing as
Mm,
it's supposed to produce, then
mm,
we start seeing all these things in our body, feeling tired, feeling emotional instability, feeling that, you're sick, your headache, and all these things.
mm.
So that is what happens with estrogen.
Wow. Wow. Well done. Well done. Well done.
Mm.
Okay, I'm just thinking this question is coming to my head before the next one. Is it possible to bypass all these symptoms of menopause? Because actually, I actually was discussing something to a friend, Sammy, about a couple of months ago. So I was talking about, we're looking at this menopause issue that
Mm.
most women go through all these things. You've been through pregnancy, you've been through period. Some people have ridiculous period pains and all that. Now menopause because you want to stop something and you want to enjoy your life. And now you're having another issue. So I was just saying that I remember when people used to talk about period, and people say, oh, they have painful periods. Some people they won't be able to even go anywhere for days when they're having period. Even the ladies that 3 days, 5 days, they're on the floor rolling because they're having period. And I remember growing up, I said to God, I said, God, I don't want to go through all those things. Even in pregnancy, you see people splitting
Mm.
and all that. Actually, I know I am a bit deviating from this menopause something, but it's still centering on. I just want to pick up, get somewhere and ask this question. So I remember that people splitting. I remember even before I got married, I see people sitting next to me on the underground. There was a lady that was splitting in a bottle. I didn't even know. I thought he was drinking the chocolate. Then later, I was like, oh, she was splitting, put it by the side. And so many things, see, swollen leg and all that in pregnancy. Then I look at this, I said, God, if I get married, I want to have baby. I don't want to go through all this splitting, swollen leg, even some ladies, they look so, I won't say ugly, beautiful, because everything God created is wonderful and, and fearfully made. And some people, the way they look, although people say because of the sex of the baby they are having, and some will look beautiful. And I said, God, I don't want all these symptoms. And yeah, we know I'm talking from being my own belief. And I said, and this thing did not happen to me, truly, because I said to God, I don't want all this sign. Now, when I'm hearing all this monostop, monopause, something about all this pain, flushes, this, that, I don't even know. Maybe I have some symptoms. I don't even know. Maybe it's menopause and I'm thinking it for something else, like you said. Because sometimes you might have some symptoms of pain and all this thing. You'll be thinking that, okay, it's normal. I used to feel that it's normal. So I'm not thinking that, is it possible for someone to just bypass these signs and let the thing just stop and enjoy your shape post monopause thing, you call
Yeah.
it? Exactly. Is it possible not to go
Well,
through all these symptoms at all?
well, I want to
Because
say there's
I
something.
pray that with my, when it comes to pregnancy days, and it's happened, truly. God did it. No
Oh,
swollen leg, no splitting. Yes, sometimes I've been moody, but all these signs that people find it so ridiculous, I don't know. I said, God, I don't want it. And He didn't give it to me. But is it possible? I know how things are possible. So, what do you think as a midwife and expertise in menopause?
well, I want to say that it is with God all things are possible.
True.
But what we just need to be aware that there's something like menopause.
Yeah.
Because when you know that there's something like menopause, then you
Mm-hmm.
can start praying it. Like you said, you were praying that God, I don't want to have all these symptoms. It's because you knew that there was pregnancy, there will be pregnancy, that you will get pregnant and you have babies. But when you are not so much aware that, okay, these are the things that happen in men when people reach that age of menopause, then you will not be able to pray about it.
Mm.
I mean, you have been preparing yourself. God, please, God, I don't want to have this. I don't want to. But if you don't know, if you are not aware that, yes, all these things can happen, it will
Mm.
just come to you like a thief in the night. You know,
Mm.
and you just start having, and all of a sudden you think maybe you are dying because all the things that are happening to you, all the symptoms are, actually happening. Sometimes you might be having like numbness in your feet, in your legs,
Mm.
you know, pain in the pelvis, pain all over the body. So
What
but
about
if you
dizziness?
know, yes, you do. I'm telling you, there's nothing people, I mean, I'm telling you, like I said, people experience it in different ways.
In different ways. Yeah.
But until you actually go to your GP and
Mm.
start maybe all the tests in the world, some people might even think they're having kidney problem.
Mm.
Some people might
Mm.
be thinking they're having liver problem. So they
Mm.
will do all the tests in the world and nothing will come out of it.
Mm.
But
Yeah.
if people are aware that, okay, it is possible that this and that, and most especially, when you are going through all these stages, like, oh my God, I hope I'm not dying. What is wrong with me? Why am I having this? Is it this disease? Have I got kidney disease? Have I got liver disease? Have I got that? Enough can
Mm.
cause one to be unwell. But when you are aware that, yes, these are the things that happen to people
Mm.
when they are going through this stage, then you can choose to say, no, I want to handle this with prayer.
Mm.
That means, like you said, I don't want to have these pregnancy symptoms.
That's
And
sweet.
also, it's possible. It's
Mm-hmm.
possible. There are some people that they just go through that stage without even knowing. All they did was they just didn't see their period.
Mm. That's
They
true.
just didn't see their period anymore. And
Okay.
some people, they will go it, I mean, they will go through it minimally. I
Mm.
remember there was a time, if my I have a sister friend, and she said, oh, my pastor told me, these are the things I'm feeling. No, I don't know what is happening to me. I've been to the hospital, and I started laughing because me, I realized already that that is what she was going through. I
No.
just started laughing. I said, why are you laughing? I said, it is perimenopause that you are going through. That, that's the transition between, transition to menopause. So I
Mm,
have to make that aware that this is what is happening to you.
mm,
Think, oh, maybe you're having high blood pressure because you're having palpitation, you're having all the, so you have to do all these tests.
mm,
But there are some people that can actually, I mean, not, they can escape this period.
yeah.
And there are factors that can affect those ones. Like number one is prayer.
Mm,
You can choose to say, God, I don't want to have all these symptoms.
I don't want it.
And since I knew, I've been take charge of it. Like, wait, no, I command you, get out in Jesus' name. You are not part of my, you cannot have control over my body. But if I knew
Mm,
that those are the things that people go through, maybe I would have taken care of it, before
mm,
then.
yeah.
Some things can determine how people go through it. I mean, what the level that they experience it. It's
Mm,
just like ethnicity, culture,
mm,
lifestyle, environment,
mm,
can determine. Some people, if they smoke, if they like,
mm,
they do, if they smoke, they can experience it in a terrible way. You know,
mm,
yeah. Some people, like black people experience it. I think they have those symptoms more than whites and Asian people.
mm,
Asian people, even research find out that they are less likely to suffer from menopausal symptoms.
mm, mm.
The Asians, they are less likely to suffer from those symptoms. But
Why
research
is that?
show that black women, they
Mm,
experience it more than even white women.
really? Why is that?
I do not know. I think it's a make. Like I said, ethnicity
Ethnicity.
is part
Okay.
of the factors. Race, part of the factors. So it's I don't know it. It's only God who knows how we have been made and everything. But those are the factors that research has shown that affects how you go through that period.
Mm, mm,
Yeah,
mm.
yeah.
Thank you very much. I think with this menopause, the reason why we were not prepared for it is because, as we said earlier on, that our parents, they tell us to do, oh, don't go to men. If you get closer to a man, you get pregnant. Clean the house. This is how you behave in your husband's house. You respect your in-laws and all that. Cook for your husband. They prepare us for all those stuff, but they don't prepare us for menopause. But it might be the reason why people are not prepared, and when this thing happens, say, what kind of sickness am I going through? And because with pregnancy, you see people, they split all over the place, they have swollen leg, they behave. So I think that's why I was aware, because I remember, was it not last month, I was asking mommy, I said, mommy, do you know your symptoms when you get to menopause? And mommy said she couldn't even remember. So I think that is why. So sometimes it's not their fault because their mom didn't tell them. So when they pass through that thing, they just think maybe it's normal sickness. They took
Mm,
herbs. Our parents, they prefer herbs to all these tablet things, and that's it. And from there, they transit to final menopause, or what's it
yeah.
called? Anyway, the other
And I
question.
think, I think sometimes, because I'm just thinking about it now,
Mm,
that maybe because sometimes we would have left home,
mm.
maybe gone to school, and from school we've gotten a job somewhere, or we'll get married before
Oh,
our parents get to that stage of menopause. Or
yes.
sometimes, maybe when we even see anything about menopause,
Mm-hmm.
we will not pay attention. We think that's not my business. What's my business? Because now I can assure you, if you post this out now,
Mm.
children, ladies of 22 years old, 20, they will not watch it. They will think that was my business with menopause. I've not even I'm not even pregnant yet. What am I thinking about? So they will not want to listen to such, because it doesn't concern them. They will believe that, oh, it's only those who are like 50s, 40s that can listen to that kind of a thing. We are right. That is why we are doing this now, so that everybody will be aware
Mm.
that, look, it's better to know ahead so that you can prepare your mind And you can, if it's prayer, you have to pray that God, I don't want to experience those symptoms, you know. And even if you go through it, you know that okay, this is what is happening, and you know how to manage yourself. So it is very important. Awareness is very important, and that
Yeah.
is what we are doing today. And I think those reasons, like I can say, maybe we have left home, or
Mm.
maybe our parents, they're even complaining that, oh, I'm having these symptoms, I'm having this. And we say, Mommy, what's wrong with you now? Maybe you had paracetamol yesterday, you went to your hospital yesterday. But because they themselves did not know what they were going through,
Yeah. Yeah.
they didn't know, they didn't have the knowledge of it, understanding of it.
Mm.
So um everybody just go through it, and until you go through it, that is when you know that this is what it is.
It is what it is. It's true.
Yeah,
It's
yeah.
true. Yeah, I think what you said is right. And because of the age we're living now, the food we eat is changing everybody's hormone system and all
Yeah.
that. So now that the younger ones are even getting it earlier, like I said, I was told that a lady of 25 years old has reached her menopause. Even someone was telling me that a lady of 22, I said that 22 is so early. Menopause, that's for
Mm,
22 years old, that's so early. So I think because younger ones are getting it earlier now, they will pay attention when they
mm,
see anything out there regarding menopause and say, okay, I think
yeah.
it's something we need to know. Okay, I want us to talk about this. So actually, I don't want to skip it. I know you mentioned about it can affect sleep, but I want us to dig deeper. Can menopause affect sleep patterns, and what are some strategies for improving sleeping during this time? So when people are going through menopause and the issue they're having is regarding sleeping difficulties, so what can they do to improve their sleeping time?
Okay. Um Well, like we all know, sleep is very important, you know, for a human, for us all.
Mhm.
Anybody that is not sleeping, eventually they will have issues with the blood pressure, they
Mm,
will have issues with their mental state, they
mm,
will have issue with so many things. They will be tired, they will
mm.
not be efficient in whatever they do, because sleep is very important.
Yeah.
It can affect the brain, it can affect, if you're not getting enough sleep.
Mm,
So if you know that you're having problem in your sleeping pattern,
mm,
um, I believe that you must know the things that, I would normally advise people that, okay, what are the things that you know that when you do them, it relaxes your body?
mm,
Because when your body is in a relaxed state, you know, you can say, okay, now I want to sleep. What everybody's what relaxes, what's put you into state of relaxation is different
mm. Yeah.
from mine. So you must know yours and say, okay, what are the things that I can do? Some people is when they read book.
Mm,
Some people is when they've had a shower and they just had a cup of hot chocolate drink, and you know, and some people that is for them. And some people is when they do it. You'll be surprised. Some people is when they do exercise.
mm,
Some people when they do exercise at night, or that is when their body, their whole system wakes up. But for some people, they will tell you, when I do exercise at night before I go to sleep, I sleep deeply.
mm,
And for you to know, exercise is very important as well. When you going through this period, so that your body, you'll be able to sustain and maintain your bone density,
mm,
even if you are taking vitamin D and other things that can increase your bone health. Exercise is very important. And so for you, so you have to look at, okay, what are the things that make me to be in a relaxed mode? And so you just have to find that out yourself, because it's different from individuals to individuals.
mhm,
So what are the things? And just make sure that you are mentally, that you're not working yourself up. Make
mm,
sure that the time when you are not sleeping, don't now start being active. Okay, at least I'm not sleeping, let me just start doing all the things that I'm supposed to do during the day. No, don't do that. Just make sure that you are in a restful state,
mm,
because when you're in a restful state, then sleep will come eventually. And when you know that you're not able to sleep during the day, even during the night, sorry, during the day, if you know that, okay, I have these 2 hours that I can sleep, please sleep during that time.
Okay.
That time that you are going through those sleeplessness, just try to find yourself that, okay, I wasn't able to sleep my 6 hours or 7 hours last night, but
Mm,
day maybe I was able to sleep only for 4 hours. Okay, this day, okay, I'm less busy, let me sleep for 2 hours
mm,
during the day. So you must try and see how you can balance that sleep pattern.
mm,
It doesn't have to be at night, but you can make it up during the day. But just make sure that you are sleeping enough,
mm,
because sleep, our brain needs sleeps to function well.
mm,
And if you are still working, you don't want to get to work and you're just there, you're not effective,
mm,
and you don't want to be, because when you're not, you're really tired, you are not sleeping, your emotions will just be all over the place, because now you can, any little thing you start crying, because so make sure that you look at the pattern at that time.
mm,
Okay, normally I normally sleep 6 to 7 hours, but this time, because of what I'm going through right now, I'm able to sleep only 4 hours. Find some times during the day that you can balance it up,
mm.
and I think that should help.
That's very useful. Thank you very much for that advice. Sleep, sleep, sleep is a therapy.